While colon cancer is on the rise across the board, the most alarming statistics are for those under the age of 50. Joining us now to talk about these troubling trends is Dr. Drexel Dobson with Orlando Health Medical Group Surgery. Thanks so much for being here with us.
Good morning.
So the numbers are pretty incredible. Since the 1990s, the incidence of colorectal cancer in those under the age of 50 has gone up by 90%. That sounds like an epidemic. What is going on?
It has. We've noticed that although our ability to detect cancers and polyps in older people has gone up consistently, we're seeing a rise in the patients, certainly below 50, that are experiencing colon cancer. In fact, it's becoming not quite a health emergency, but definitely something that we need to look at how we approach people in that age bracket that have symptoms.
Okay, so we're talking probably about some of the usual suspects: poor diet, processed foods, lack of exercise, sedentary lifestyle. But some people have thrown into the conversation microplastics, delayed childbearing. What are your thoughts on that?
There are a lot of things that you can look at statistically. For instance, there is a thought that even if you have your gallbladder removed, there's an increased risk of colon cancer. The one thing we do know is that all the things that you mentioned, in the addition to changes in our environment, in our gut, predispose people potentially to having acceleration or formation of polyps, which eventually leads to colon cancer. A lot has to do with our diets. Eating processed foods and certainly eating a lot of red meat can be a problem. We haven't quite nailed down the exact causes, but we do know that these general associations lend to a higher risk of colon cancer. So we have to be very, very careful in what we put in our body.
The go-to test for several decades has been a colonoscopy. There have been some new types of testing that have emerged in the last few years. One is a stool sample test that you can actually do in your own home, and another is a blood test that was just recently approved by the FDA.
Correct.
Are those okay for everybody?
Like every test, no test is 100%. The beginning of colorectal cancer is virtually silent. Okay, by the time you have symptoms, it can be moderately to significantly advanced. In the past, we used to test for blood in the stool, and that was a simple chemical test. It could have been falsely triggered positive by eating red meat or certain food dyes and things like that. So we were able to create a test that detects DNA in the stool. We now have a test that's come out, and it detects the DNA before it's even detectable in the stool in your bloodstream.
Wow.
But those haven't been validated for general use in the public, although that is coming, and it's certainly something to look forward to in the next 3 to 5 years.
That is very promising. And thank you so much, Dr. Dobson. We really
welcome.
appreciate it. And if you would like more information, you can visit orlandohealth.com/general surgery.